Hi, my name is Caitlyn, and this is my EDP 520 article presentation in spring 2018. So the article that I'm choosing to present on is actually my own research that I conducted under Dr. Guido Urizar's Smart Moms Lab in my undergraduate study that I worked on in 2014 at California State University, Long Beach, and the article is called The Effects of Learned Stress Management Skills on Stress Levels Among Low-Income Pregnant Women. So prenatal stress has been linked to numerous health risks for both mother and infant, including miscarriage, low birth weight, heart disease, bone development, and genital and intestinal abnormalities. Exposure to stressful events during pregnancy is a major contributor to preterm birth, which occurs in 12% of all births in the United States and is the leading cause of neonatal death in the country. So despite all of the many known associations between maternal stress and fetal development problems, pregnancy stress prevention techniques have not successfully reduced these negative symptoms. Cognitive behavioral stress management, or CBSM programs, have been used to teach relaxation and coping skills with the goal of reducing stress in a number of health populations, including women with breast cancer and HIV-positive patients. However, few studies have evaluated the efficacy of CBSM programs during pregnancy and the link to positive outcomes for both mom and baby. The purpose of the study was to examine whether prenatal CBSM program was effective in reducing stress levels as seen through the perceived stress scale from the first trimester of pregnancy to 3 months postpartum, and to explore what relaxation and coping skills particularly were effective for helping women reduce their stress long term. This was actually a mixed method study using both qualitative and quantitative design. So the first two hypotheses that we came up with were both pertaining to the quantitative aspects. And so the first one was that women who attended a greater number of the stress management courses would have significantly lower levels of stress at 3 months postpartum. The second one was that women whose stress levels decrease would report using more relaxation and coping skills from their CBSM training than women whose stress stayed the same or increased. So then that last one, the qualitative analysis, we interpreted would reveal a trend in specific techniques most often used by women whose stress decreased over time. So that's to say that we were hoping to analyze the women's responses as far as what techniques they were using and just kind of take an overall look and see if there was a trend in those women whose stress decreased. So the participants in this study was a sample that consisted of 44 pregnant women who were all low income, with 80% earning less than $20,000 per year, and 72% of them were Latina. They were taken from a larger longitudinal study approved by the IBR of California State University, Long Beach, and these women participated in an 8-week group-based CBSM program during pregnancy, with the average number of classes that they attended of those 8 classes being 5.27 with a standard deviation of 1.91. And then at 3 months postpartum, the woman completed a semi-structured qualitative interview that evaluated which stress management skills continued to be used during the postpartum period. The eligibility factors were that they were 18 years of age or older, that they were under 18 weeks pregnant at the time of the initial CBSM class, that they were English or Spanish speaking because we offered the class in both languages, and that they didn't have any substance abuse or medical or psychiatric problems that already occurred. So the measurements that we used were the perceived stress scale, which is the most widely used psychological instrument of measuring stress perception. It was created to assess the degree to which respondents consider their lives to be uncontrollable, unpredictable, and overloading. And the measure also predicts biological markers of stress, and it's a 14-item questionnaire. And it was used to measure stress levels of each woman at baseline, and at 3 months postpartum, we subtracted the baseline score from the 3 months postpartum to assess for change, either increase, decrease, or no change. And then at the 3-month postpartum mark, woman completed a semi-structured qualitative interview that evaluated which stress management skills continued to be used during the postpartum period. And the questions specifically used for this research study that we used to evaluate their answers were, what do you feel that you have learned from your 8-week program with us? So here's a little snippet of the results that we found from the qualitative analysis. And as you can see, the ones on the left-hand side, those are the themes that we kind of pulled out from that question. People discussed control, awareness and stress, breathing techniques, relaxation techniques. They also discuss some other things that don't show here on this little snippet of results, such as imagery. But as you can see, the middle column shows the participant whose stress increased, and they were definitely more succinct in their responses, fewer details, not as much to kind of convey, whereas the woman whose stress decreased, they showed a lot more learned, in that their responses were longer, they were more in depth. For example, if you look at that bottom column, the relaxation technique, one woman said, I recall doing certain relaxation that they taught us, whereas, and that was a woman whose stress increased, whereas the participant number 47, whose stress decreased, her quote was saying that, well, relaxation has helped me imagining things to relax, the beach, a forest, flowers, a river, waterfalls, etc. That was part of the imagery that we walked them through in the CBSM training. So the results for the quantitative hypotheses didn't yield any significance as far as the correlational relationship between attendance in stress decrease or the number of techniques reported in stress decrease. But the qualitative results did show, or the hypothesis was proven true, that there were a trend in self-reported techniques and stress level change, in that the women whose stress decreased were more likely to report guided imagery techniques being learned, though both women both groups of women, those whose stress decreased and those whose stress increased, they both reported using breathing and relaxation techniques equally. However, it was imagery that was reported most often in women whose stress decreased. Also, a woman whose stress decreased, something that was really interesting that we didn't predict at the beginning was that they reported a higher frequency of not acknowledging that they felt that the classes had taught them to be more in control of their stress and relaxation in the postpartum period. So these were women who spoke more about feeling that they had learned something. And so the conclusion is that the longitudinal study demonstrated that low-income pregnant women whose stress was lowered from a CBSM program had a trend in self-reported techniques used over time. And the limitations of the study is that while the PSS is proven to be an accurate measurement of stress, this particular study may have benefited from evaluating cortisol levels in both the mother and the baby, which is actually something that the larger study did do. We collected cortisol from mom and then from baby at the 3-month postpartum mark, and they just hadn't been analyzed at the point of this study, and so it would help to see not just perceived stress but actual stress changes in both mom and baby. And then another limitation is that low-income women are already at higher risk for stress and may have had extreme life events that hinder their ability to manage their stress levels. That is to say that we didn't give them any crisis intervention, and the low-income women are more at risk for crises or for coming across higher stress incidences in their life, in their day-to-day life. So the CBSM program might have been less effective on this population than it may have been in another population. And so future research, given the interesting qualitative trends found in the current study, should consider looking at links between prenatal CBSM programs and self-efficacy increases, because like I said, that was one of the more interesting things that we hadn't accounted for, but then found in a trend, is that women whose stress was decreased often reported feeling that they had gained a control or empowerment over their stress, which may lead to significant findings on self-efficacy increases, thereby indicating that self-efficacy is related to stress deduction in low-income pregnant women. And so that's what future research should expand on, is the involvement of self-efficacy, and see if they can pull out of that. So I'm sorry to have condensed this into a brief 10-minute report, but however, thank you for watching, and I hope you learned something.